Hello, everyone, and welcome to today's podcast on workforce health literacy. My name is Seth Serxner. I'm Chief Health Officer at EdLogix. With me today is Ellen Kelsay. She's the President and CEO of the Business Group on Health. And we really want to focus today on strategy. The business group has done a survey we're going to talk about. They actually launched it, I believe, in July or August of 2025. I found it to be quite insightful. So, Ellen and I are going to have a little bit of a conversation about these findings. But before we do that, Ellen, again, thank you so much. We've known each other for many years. It's been a pleasure working with you and getting to know you. If you could take just a moment, tell people a little bit about your background and your role before we jump in, I would really appreciate it.
Well, sure. And thank you for having me. This is so fun to do this together. And yes, we've known each other a long time and always happy to have a conversation about important things. So a little bit about Business Group on Health, for those that might not be familiar with our organization. We were founded over 50 years ago, and we are the largest and longest standing association working with employers on healthcare and well-being related issues. Our membership community is a multi-stakeholder community, first and foremost comprised of employers, self-funded employers who are doing an awful lot to provide robust healthcare and well-being resources and services to their employees and by extension, family members. Also within our membership are what we call industry partners. It is anybody else that is providing services and solutions to employers on behalf of their workforce. So think companies like health plans, health systems, provider groups, startups, consultants, health tech, pharma companies, you name it. So truly a very diverse multi-stakeholder community that we convene all the time, in person and virtually, to talk about some of the challenging issues in healthcare and also what are the opportunities and how do we collectively link arms to try and remedy and address those challenges and take advantages of the opportunity. We create a ton of content and resources for our members, resources, publications, surveys, infographics, toolkits, guides. We have our own podcast. We do a webinar series. We advocate on the Hill as well as in the market. So a lot of resources available for that community and through that community. And because of that community, we are able to glean some really unique insights and perspectives that happy to share with our audience on the conversation today.
And I've been part of the business group, I won't say 50 years, but pretty close, and seen some evolution, always providing value, always focused on the employer, always a collaborative approach, several institutes. So if you're already a member, participate as much as possible. If you're not, come and, take advantage of the resources. And Ellen, we don't have to go through your whole bio, but just a little bit about your background would be great. And then we'll jump into the content.
Of course, yes. I have, for 30 plus years, been in the healthcare field myself. The past almost nine, April will be 9 years here at Business Group on Health.
That flew by.
Yes, it did. It's hard to believe. Currently, as you said, President and CEO, initially for the first few years, led strategy for the organization. Prior to joining Business Group, I was at Mercer for 20 years, very formative years of my professional development, held many roles at Mercer, from analyst to consultant to leading different markets, different size P&Ls, leading different strategic projects and operational projects for the organization. And prior to that, I was at Aetna. So the through line throughout all of those roles has always been working with employers on healthcare issues. So my entire career has been in healthcare and employers and lots of different hats on that journey, but have always been grateful for the opportunity to work with some of the leading employers globally as they are working really hard and diligently to do their level best to provide very meaningful, robust services to their workforce.
Perfect. All right. So let's jump in. Let's talk just briefly about the survey. We don't have to get heavily into the methods, but I know there were about 121 employers, about 1.5 million lives were covered in the survey. We're going to go over some of the content, but anything else you care to add about the methodology before we jump in?
Yes, 2 decades we've been doing this survey. It was in the field this past summer for a couple of months. As you mentioned, we had over 120 employers participate, representing 11.5 million lives. So sizable population represented in the respondents, all different industries, all different sizes, as well as, certainly many here are predominantly located here in the US, as well as multinational employers. We field a survey for a couple months, as I said, in the summer. We take about a month to distill, digest the results, and we release the findings in August of 2025.
Great. So when I saw this, I went, wow, there's a lot here. This is really helpful. And I know that you promote it, but I felt that I really wanted to start to talk about some of these things. And before I did that, I reached out to you. You said, well, I'll chat with you, Seth. So I thought, this is great. So let's talk about the first one, which is healthcare costs. And Ellen, you said you have been doing this for 30 years. I've been involved 30 plus years. Healthcare costs continue to rise. 9%, give or take. Employers do plan design changes. Maybe they can bump that down a few points. This is a big increase right now, and we know it's a big part of it. It's a huge part of GDP, all those things. It increases 2, 3, 4 times the rate of inflation. A couple times we've been able to step it down. Talk a little bit about what's the reaction to this? Are employers panicked? Are they scrambling? How are they dealing with this continued challenge?
You are absolutely right. We have been talking about healthcare costs forever. For a long, long time, I've been saying that they are unsustainable.
Right.
We've said now this year, we can no longer say that they're unsustainable because by the very definition, these healthcare costs have sustained themselves at this rate of increase for far too long, sadly. The findings in this year's survey were especially sobering. The 9% trend is the highest it's been in over a decade. And we looked back over that 10-year period, and on a compounded basis, that's a 62% increase in that decade. And what's especially concerning, and I can speak to some of the drivers of that, what's fueling that 9% this year. But what's especially concerning is the factors that are fueling it are showing no sign of abatement. And potentially this could be it gets worse before it gets better scenario, where maybe even in 2026 and 2027, we'll see perhaps even trend numbers higher than that 9%, maybe something like 9.5% or even 10%. So it is a wake-up call. It has certainly gotten the attention of employers who've long been focused on this, but also within the employers, CFOs, CEOs. It's gotten the attention, obviously, of consumers and employees. Healthcare affordability is a real challenge. And we've been talking about that for a long time, but certainly in this macroeconomic environment, affordability of many things, food, housing, you name it, but healthcare is at the very top of that list. So for so many reasons, the conversation about healthcare trend and costs has a very different flavor, a level of urgency that we've not really heard, certainly in the past decade or even the past couple of years.
Well, I'm glad to hear it. And I'm glad to hear that we can engage the C-suite in more than just go handle it kind of thing. We know that it's going to take this multi-pronged approach that we'll talk about some of these pieces. But one thing I wanted to touch on before we move to some of the factors driving all this is there's really two sides, right? Demand side and supply side to all of this. The demand side being how much the population uses the healthcare system. And then the other side is what's the supply, the cost, the quality, all those things. We're trying to address both. Sometimes we squeeze a little tighter on the demand side and we think, oh my gosh, we have to deal with this. Sometimes we look at both. Do you think there's one area that we should focus on more than the other, or there's more opportunity on the demand side than the supply side? Or, how do you and the business group think about that?
They're both very critically important. When you think about many of the drivers of the trend are not new drivers. It's, decline in overall population health. It is the rate of chronic disease. It is obesity, diabetes, cardiometabolic health decline. And we've seen a lack of a proper prevention, primary care, focused on getting their cancer screenings done, et cetera. So there's certainly an opportunity to address the demand. In our trends to watch, we call it a little bit of a back to the basics, back to the fundamentals of the importance of prevention, primary care, immunizations, cancer screenings, the importance of just, trying to live a healthier lifestyle in all ways that you can, whether that be physical activity, nutrition, et cetera. So we are definitely seeing a need and a reiteration from employers to underscore that in their communication to their employees. We've seen a little bit of a pendulum swing where employers in the pandemic days and the years following the pandemic have done so much to provide additional services, vendor offerings, new benefits, flexibilities in terms of time away and workplace flexibilities in terms of schedules, really to support and bolster workforce health, well-being, how employees feel about their employer, how they're engaging with their employer, their productivity when they're working, obviously trying to keep them healthy so that they can be productive. But that also became a little bit of a runaway train where employees were expecting employers to do anything and everything for them. And there wasn't as much direct accountability on the employee themselves to take care of their health. And so we've seen some employers still do all the things that they've been doing. They're not backing off of any of those programs, but there's a little bit more of a narrative in their communications around, hey, you too have a responsibility to take care of your health. We are going to do all these things that we can do to support you. We are going to continue to invest in these programs, but you as an employee do need to be an active participant in managing your health and helping us to keep healthcare costs down. Now, not everything is preventable. Some conditions you are born with. There are some things that you get surprised by. There are catastrophic illnesses. But the things that can be prevented, employers are really trying to help employees get ahead of those things to be more effective in managing their chronic diseases. On the other side, there's so much that needs to be done within the healthcare ecosystem itself.
Before we go on to the supply side, let's just talk about that for a second, because I agree with you. Employers, to their credit, threw everything they had during the pandemic to help employees and their families. And then I think there's been what I've heard is a little bit more drastic than you've kind of laid out, that a lot of employers said, wait a second, I have way too many programs. People don't even know what's out there. I don't even know what's working. And the age-old issue of engagement. For me, when I think about strategy, one of the things I always think about is engagement. Look, you can have the best programs. How are you getting to engage people? You talked about the communication strategy. Absolutely. We're hearing that culture of health, culture is always been important, but it's a challenging time for culture. Some employers are cutting back. There's a lot of at least flux in the marketplace, given AI and other technologies. Political environment has changed kind of business certainties. So what I'm thinking about during this strategic time is I hear employers are rethinking all the programs and services they have. And what is the value of those? For me, I always start with, is there engagement? That's a good sign if there are programs that you get engagement. There are others that we're not engaging, but we think would be really powerful. So how do we get that engagement? And then, okay, what are the best programs out there? Are you also hearing a little bit of this?
Yeah. And I'm so glad you asked that, because when I said they're not taking anything away, they are taking things away in terms of the numbers of solutions, but they're not removing services necessarily. So as an example, an employer might work with 5 different vendors today that offer some bits and pieces of behavioral health support or mental health support. They might go from 5 to 2, but those 2 are still going to offer the same suite of services, but done in a more condensed and consolidated and integrated fashion. So to your point on the strategy, employers are taking a hard look at all of their programs, all of their vendors. Are they delivering the outcomes? Are people engaging with them effectively? What data are they getting from their vendors to validate those outcomes and the performance of the programs? So yes, there is a strategic reckoning in terms of their vendor partners. And even those that are performing well, and many employers will look to say, I have 5 different vendors in the behavioral health example I just mentioned. They all might be doing bits and pieces of the offering well, but to an individual consumer, it's 5 different vendors and it's very confusing. So employers are looking for integration and consolidation within their vendor ecosystem, and then collaboration across partners rather than having, very siloed partnerships, bringing their partners together. We've got many employers, and you're probably familiar with these examples as well, who are increasingly doing vendor summits where they're bringing all of their vendors together to say, how are we collectively going to help manage the diabetics within my population or the obesity challenge that we're all trying to
And
deal
so
with.
vendor summits is a great example. Like we've been doing vendor summits forever, and there are quote what I would call best practices with vendor
Yep.
summits. And then there are others. So again, as people are thinking about their strategies, I wholeheartedly agree. We've got to get the vendors to work together to share data. In my experience, and again, I'd love to get your take on this, vendor summits are one of those things where it's not just a one and done.
No,
Vendor Summit is a kickoff for relationships ongoing, whether it's monthly calls, whether it's how we're going to integrate the data, how we're going to do handoffs, how we maybe going to get some cost efficiencies out of this
yep.
collaboration. So that vendor coordination, that collaboration is, I think, an important task in and of itself. And a summit is just one strong piece
It's
of it.
just the beginning of it. You're right. And the
Yeah.
data piece is sharing the data,
Mhm.
aligning on the metrics that are going to measure, aligning on performance guarantees. What are the collective guarantees that everybody can align and agree with so that we're all marching to the same, destination arm in arm with each other?
Yeah, absolutely. Let's talk about that supply side for a second and talk a
Yeah.
little bit about how people are doing value-based care, centers of excellence, quality-based initiatives.
Yeah, I mean, there's so much to say on the supply side. Certainly, you just mentioned some of them. There are increasingly a desire to move towards quality and away from fee for service. And so employers are doing that through exploring centers of excellence, looking at quality-based network arrangements, looking at advanced primary care models. On the supply side, too, employers are also, we talked just about the integration and the partnership across partners. That's very important. And then also, there are so many new entities that exist today that did not exist 5 years ago. Alternative health plans, alternative PBM models, and they are giving some of the incumbents a run for their money. And so employers have more things to consider, more strategic options available to them. They need to be very smart, sophisticated about how they assess those options, where they might deploy them. Do they do it on a pilot basis? Certainly a PBM, that would be a total replacement, but those are, sometimes more disruptive things to do. And as we talk about some of these supply side levers that can be pulled, employers need to also embrace disruption, and they need to become more comfortable having conversant business impact conversations with their CFOs or CEOs to make the business case for change, and also to have effective change management tactics as they're deploying some of these within their workforce.
When you say that disruption, because when I work with employers, one thing they don't like is noise. We'll call
Yep.
it that, right? And it's really amazing. Some employers, if it's just a couple people, it's a
Yep.
problem. And on the other side, maybe there are some alternatives. It's a lot of work. I think in this area, there's expertise that is needed for all of us. Even the consultants and the best in the field are still working out what are quality metrics, what would a good contract look like, how do you do it with the least disruption? Are you seeing some successes out there with, that shift a bit?
It's interesting when you think about disruption because all of those things are true. Noise is hard. People, we could have just two very squeaky wheels, that get the attention of a CFO or a CEO that can totally upend a decision that was almost done.
Almost there, right?
Right. And took a year and a half or more to get to that point, and then the plug is pulled. So, what we are trying to help employers in this reframe about disruption is the current state is already highly disruptive. So, let's not fool
Fair
ourselves
enough.
by
Yeah.
thinking
Yeah.
doing nothing saves us from disruption. We just talked about affordability. We talked about none of these cost drivers abating anytime soon, that patient experience is subpar, that people are getting sicker, not better. People can't afford health insurance anymore, that trend increases are putting pressure on wages and other things that employers might be able to do. So the current state is highly disruptive. So a little bit of the reframe about what change means, and the change could be changed for the better. So disruption doesn't have to connotate negative. It could be positive disruption. And so helping people think about it a little bit differently and not thinking of it only as a negative, but to help think about a path towards something better. And what is that better? And then, of course, the communication and change management. That is something that we probably have underinvested in, whether it be, internally within employers or their advisors or their vendor partners, really helping them navigate the change and the communication efforts that are necessary to articulate both the business case for the change, but then also what that journey is going to look like as people are experiencing it.
For me, that impact on the employee, and they're already feeling it, right? We've cost shifted from the days when employees had almost no contributions to 35, 40% or more, lots of different angles to that. One thing, obviously, this podcast has had a lot of focus on health literacy. It's a solution that I rarely see brought up in the strategy, at least under that term. Sometimes there's, oh, we need to help people understand what their benefits are and how to navigate the system. For me, a lot of what we're talking about now is health literacy, understanding the dynamics of the healthcare ecosystem, understanding your own health, whether it's in the kind of preventive space or whether you're managing a chronic condition or an acute condition, all those dynamics. I'm wondering, as we see these anticipated costs, because that was another really interesting thing I found in the survey, was employers are anticipating more costs, to your point. It's not like, okay, this was a peak, it's all going away. They're seeing worsening population health and older workers and more specialty conditions. And for me, what I'm not seeing is the classic teach a person to fish as opposed to give a fish. This idea of how are we going to educate the population through whether it's the change, because yes, you may need a different doc, or you may need to use more digital tools, or you may need to understand quality care and go to someplace maybe not your choice first. Where do you see that coming in? Is that question coming up? Are people talking about this in a strategy?
I don't know that they're talking about it as much in the phrase of using the term health literacy, right? It's probably not quite that explicitly referred to.
Mm-hmm.
I see it laced, though, throughout many other parts of their strategic conversations. It could be, as we just talked about, the change management, the communication campaigns around why change is needing to happen and what that ultimately means in terms of the benefit to the individual. I see it in terms of the back to the basics, the prevention, the primary care, and why those things matter, and really underscoring those in the communication and the benefit design. I certainly see it as an opportunity when it comes to AI. AI is already being deployed in terms of benefit navigation, benefit communication, understanding all that is available to an individual and how best to navigate and utilize those services. I think there's tremendous potential yet to be realized in that space. And I think health literacy is a quest that's probably a never-ending quest, one that we need to continue to work at and invest more resources and time and focus on, but will probably never fully be solved.
I'm glad you brought up AI. I had a comment on that. And we all know AI could be really, really helpful. It already is being deployed in ways that we're quite happy with, and we're seeing efficiencies and better experience for people. Some of us are a little bit frightened about misinformation, misuse, just like when you go to Dr. Google. Now we're going to Dr. AI, and there's some issues there. So I think for me, I was surprised that didn't come up as much as I thought it would in the survey. I think the other issue that I'd love to just touch on, we're, kind of covering a lot of ground here. So the well-being programs seem to be an underutilized weapon, quote unquote. And I think as we do the change management and we've shifted a little bit how we think about wellness and incentives, and now well-being has become almost a word for mental health and emotional health and less the other stuff. Where do you see well-being in this strategy to address these massive trends and all the disruption, as you say?
Well, you were one of the brightest minds when it comes to well-being, as we've known for many years in our partnership with you. And as you know, we've done a well-being survey for a number of years, and we fielded that survey in May of 2025. And we were really heartened to see that employer investments in well-being are being maintained, if not expanded, by the vast majority of employers. And we were a little unsure of exactly what we would hear as we were fielding it in 2025. Against the backdrop of this cost environment that we've just been talking about. Would that squeeze a balloon on the well-being side of things? Would employers maybe need to reinvest some of those dollars into other programs? Would they just be cutting budgets entirely? We were very heartened to see that that was not at all the case because of all the things that we just said that are driving this trend: population health decline, chronic conditions on the rise, more and more expensive medications being dispensed, that employers are investing in well-being to help mitigate some of those factors. So there are two things that are tied at the hip, closely connected to each other. And well-being, to your point, is very broad. It is not just mental and emotional well-being. It is, of course, physical well-being. It's financial well-being. It's social connectedness, job satisfaction. It's a sense of purpose. And of course, it is also mental health. It's a broad category. The term well-being means lots of different things, and employers invest in all of those things. And as I said, we were very happy to hear that employers are continuing to focus and invest in those offerings and expand those offerings. Some of the areas that we see growing, of course, physical well-being is fairly ubiquitous, as is now mental well-being, but financial well-being is on the rise, as well as social determinants of health in terms of areas that employers are going to be focused on increasingly in the years ahead.
Yeah, I was happy to see those trends as well around well-being. I also hope that people put it within context. And in my view, well-being could be a non-threatening way to help employees and their families understand this pressure on all of us to be healthier, to be more clever about how we use the system, how we work with others. Even this idea you mentioned, purpose, hope. I did a talk recently with an employer, and they really see it as organizational development, and they see well-being fitting into that space. So I think there's a lot of opportunity for people, as we said in the beginning of this, if you're thinking about strategy and this kind of multi-pronged approach and how will you tackle it. We talked about, of course, kind of vendor integration and efficiency. How do we get engagement? How do we get a good culture going? I think well-being could be one of the toeholds there. But we have covered a lot of ground, Ellen. I'm wondering, is there a couple things we missed or you want to emphasize before we close out?
Just a couple things that we are keeping an eye on that maybe aren't quite as mainstream in the discussion, but, I think the focus and the role that employers are playing increasingly now in an era of some mistrust or misinformation, generally speaking, regarding public health, whether it be vaccines or other things. We're seeing a lot of questions from the workforce about how they should be thinking about those things, questions in terms of coverage decisions. And I think the employer role and their strategic orientation to how they think about their role as a communicator related to messages like that will consume more of their time and focus, whether they want to or not. They're being thrust increasingly into that position of helping to decipher some mixed messages around, basic public health concerns. So that's an area we're definitely keeping an eye on. And you mentioned earlier the longevity and the impact of people living longer lives and perhaps working longer, and what that means in terms of all of this: healthcare cost, wellness, well-being programs, different offerings that might need to be available to people as they age and continue to work and stay, employed as they're aging and maybe having some different health and well-being needs as they do so.
I'm glad you brought up this last issue. I see it as trust. We know that employers are one of the most trusted sources of health information and, ongoing recommendations. Informed decisions is what it's all about. The World Health Organization says that health literacy is a greater predictor of health than income, education, or race. So as we think about this trust and how do we help people sift through all that information, I think it's a very important role that employers have always played. I've never been with an employer that haven't always wanted to do the best they could for employees. Yes. And I think for the most part, while there are organizational changes, employees appreciate that. There's a lot of loyalty, things change. So again, in this strategy, how do employers foster trust? How do they drive a culture of health, engagement, well-being? We have a lot to think about.
We do.
I hope all the employers that are out there working on their strategies, that this got them thinking a little bit. Go to the business group, find the surveys. A lot of this stuff is available to the public. and, use that data, because it's not easy to field these surveys. And that's why, as someone who used to do a lot of these too, I wanted to make sure that people were aware of the data, make informed decisions around your strategy. So thank you so much, Ellen. Thank you to the Business Group on Health and all my friends over there. Thank you, everyone who's listening. Good luck in 2026. Thank you for listening. And again, thank you, Ellen.
Thank you, Seth. Appreciate it.